Okay. Good afternoon. I am Kristen King, and my informative speech is going to be on the Ebola virus. Ebola originated from Africa, according to Feldman and Jones. This particular lethal virus first outbreak was in 1976, which was named after the Ebola River in Zaire. In March of 2014, the World Health Organization reported a major Ebola outbreak in a Western African nation. By October 2014, 7,492 suspected cases and 3,439 deaths were recorded, with Ebola being the most viral disease known to humankind, resulted in most cases of death. Being classified as a biosafety level 4, which AIDS and HIV is a biosafety level 2 agent, which means it is known to be very dangerous and exotic, potentially to be weaponized for use in biological warfare. According to the Centers for Disease Control and Prevention, the signs and symptoms of Ebola usually begin suddenly with an influenza-like stages. The most common signs and symptoms are fatigue, fever, headaches, joint, muscle, and abdominal pain. Vomiting, diarrhea, and loss of appetite are also the most common signs. The less common symptoms include sore throat, chest pain, hiccups, shortness of breath, and trouble swallowing. Once these signs and symptoms start to occur, the disease progresses to the bleeding phase, which Simpson stated typically begins 5 to 7 days after first symptoms. Bleeding from puncture sites and mucous membranes occur. Internal bleeding presents itself in the form of reddened eyes and bloody vomit. Precautions to prevent the Ebola virus from spreading starts with knowing there is a risk of transmission that is increased among those caring for infected people. Simpson discusses that precautions such as isolating them, sterilizing equipment and surfaces prevent transmissions. Wearing protective clothing, including masks, gloves, and gowns, protect contact with the body of deceased patients should also be avoided. Reducing the spread is recommended by raising community awareness. Informing individuals of the risk factors for Ebola infection. Please avoid contact with any affected person. Regular hand washing using soap and water are also required. Informing all of you about the Ebola virus is very important. Ebola virus has been an epidemic that is on the rise, so make sure you use proper precautions to prevent the spread. Thank you.
You're welcome.
Good job, Claire.
Good job. Yay, Kristen.